for cardiovascular system. So in the first year, we study the anatomy and physiology of cardiovascular system. These are the foundation subjects that every student has to study and study in a very great and deep manner because this is the foundation. Then in the general medicine, we study about the disease of cardiovascular system. In pharmacology, we study the medication and treatments. And in surgery, we study about the procedure. So by integration, what do you mean? Like how we need to integrate the topics. So for example, if we take the example of blood pressure topic, so in physiology, how you're going to study blood pressure? Like in physiology, we study what is blood pressure, what is the regulation. I'm just talking about the topic, not the entire subject. Just pick one topic. What is the mean arterial pressure? What does it do and why it's important? When it comes to medicine, we study, like it's related to blood pressure. The disease is, or maybe the pathology is the disturbance in the blood pressure. Maybe it's a hypertension or maybe it's hypertension, what a patient has. Then in the pharmacology, we study about antihypertensive drugs. It's also related to the disease, like now we know the disease, now we need to treat this. So antihypertensive drugs. And then for the surgery, hypertensive vascular complication or aneurysm surgery. So in the surgery, we study like that. Similarly, if we take the example like in the cardiovascular system itself, we pick the topic ECG. So in the physiology, how we are going to study this? So in ECG, in physiology, we study ECG basics. We learn about the waves, we learn about the intervals, and in the medicine, we study the MI diagnosis, the arrhythmias, the heart blocks, everything. Then in the pharmacology, how we study drugs which cause QT prolongation and antiarrhythmics. And in the surgery, what we study is like pacemaker indications, and cardiac monitoring drug surgery during surgery. So it's just like that. You could pick any topic. So in the cardiovascular system, if we take the example of ECG, so in physiology, let's break the topic like into further topics. So we pick ECG. Now, how we integrate the situation as like you are standing in your department, in the cardiology department, and you are an intern, and you in the physiology you learn about the normal ECG. So in normal ECG, you know how electrical activity creates the P wave, QRS complex, T waves, and how and why the waves looks the way it does. So you know what a normal ECG looks like. Now suppose that in medicine, what happens? See what happens when the normal pattern changes in medicine. Arrhythmias happen, myocardial infarction happens, electrolyte imbalance, heart blocks, and other ECG complications also happen. In pharmacology, we understand which drugs to give to correct those abnormalities and how they work and their important contraindications and adverse effects. In surgery, we learn like when the ECG changes mean the patient need an intervention, such as temporary pacing, permanent pacemaker insertion, defibrillation, or cardiac surgery. Same ECG, different perspectives and how the dots are connected. So we go like from normal to abnormal to treatment and to procedure. So let me give you an example, like how one topic, which is ECG, and we have 4 subjects. So if we want to give you a summary, so how we see is that in physiology, we learn what a normal ECG looks like, the P waves, the QRS complex, the ST segment, and the T waves. We know what's normal. In the medicine, when a patient arrives to you with chest pain and you read the ECG segment and it's not looking normal, there is ST elevation. So what do you think? You think about myocardial diagnosis, myocardial infarction. So in pharmacology, once myocardial infarction is diagnosed, you know which medication to start and which one to avoid when indicated. In the surgery, if like the artery is blocked, the patient may need angioplasty or in some cases bypass surgery. So we know now that one subject, one ECG, four subjects, and one connected story. Just how you can pick any topic that can be like from a bigger topic and make it into like subheadings and topics, and then you can integrate it with the subjects like physiology plus medicine plus pharmacology plus surgery. You need to do this, otherwise you're going to have a lot to do. So last example, if I have to give, we study like in the CVS itself, cardiac cycle is a very important topic and so many MCQs and questions like your attendant is also going to ask from cardiac cycle, and also like very minute MCQs also come for the values and everything that you need to remember like by heart. So in the physiology, if we pick the topic cardiac cycle, in physiology we study the complete cardiac cycle. We learn about heart sounds. That's again a very important topic. And then we study about the Vigor's diagram. Then in the medicine, we study about like murmurs, valve disease, and heart failure. And then in the pharmacology, we study about inotropes, and drugs which affecting the preload and afterload. In the surgery, what we're going to study is valve repair or maybe replacement. So just like how this is how we are going to like integrate our topic. First, we are going to see the foundation subject, which is physiology. Then we are going to start with the disease, which is in the medicine, pathology, then treatment, which is in the pharmacology, and then the procedure in the surgery. This is the order that how you need to study any bigger topic, like whether it's CVS, hematology, or maybe neurology. All these subjects you need to study like this, which has these four subjects in common. And this is how we are going to start our series of integrated learning series. We are going to make spider notes or maybe mind webs to make you understand better of the topic for your university exams or your competitive exams, or maybe it's very important in your internship year to learn these concepts and make a short notes of it. That's going to come really handy when you're going on your rounds. I hope that you enjoyed the video, and if you like the video, you can like or subscribe it. Thank you.